Okay, this is going to be a customized routine of midline stability for a patient. As a disclaimer, as I always say, this is something that I've specifically designed for someone. You're more than welcome to use it. However, it might not help your problem specifically. So if you need further help, I'd consult a professional or a specialist that you are comfortable in going to see. So that being said, let's go ahead and get started. So this is going to be specifically to help prevent two things. A lot of forward anterior carriage in the hips in a standing position or a sitting position, as well as prevention of this compensatory extension when we go into a bending position. So we've talked about the contraction. You seem to do it great, but I would try to do that at least a 20 to 30% level whenever you're engaged in any of these activities. That helps to allow you to create more control and to help you be more precise with specifically how you're stabilizing. So let's go ahead with some challenges to start with here for the first week. We're going to start with simply with that hip hinge. If you get a pole, whether it's at the gym or at home, a broomstick usually works pretty good. So we're going to go over that again. So you're going to use 3 points between your shoulder blades, back of your head, and right at the base of the spine. Those 3 points are going to touch the entire time. And you're going to put your hand more up towards that area where your middle back and lower back meet. And you're going to try, as best as you can, to bend forward without creating a change in that area. What we've seen in you is that you do go into a form of extension in this upper back, which is creating compression, extension compression through the lower back. That flatness could be potentially creating that aggravation when you go into those deadlifts. So try to perform this barefoot, get your roots in the ground, and try to maintain your arches. And once again, right at the base of the rib cage where the lower back meets it, you're going to try to keep that nice and controlled. So that bracing is going to help, as well as a slight thought about engaging the lower lats. What I would do is try to perform 2 sets of 15, and you can do that on a 2 to 3 times a day basis, or more if you feel comfortable doing that. Next thing we're going to talk about is that standing pelvic control. So, as we discussed, when you're in a standing position, you do want to try to do that contraction. We're going to try to level the pelvis more to meet with the needs of the torso. So if you can imagine my belt line, see it's a little tilted forward right now. Once I'm going to root my feet into the ground, try to focus my weight being into my heels, and I'm going to engage those glutes so my belt line does shift upwards slightly. And I'm going to try to hold that position as I stand. You can perform this literally all day long, but when you are focusing on it, try to do it for anywhere for up to 30 seconds of focused attention with it. Next thing I'm going to talk about are a couple more challenges, and then we'll just kind of leave it easy this first week. So the next is going to be in this 4-point position. Notice I do have a good neutral spine. You could find that by kind of extending and flexing until you find that good position. From there, I'm going to provide some challenge in terms of creating extension without having this back move into that extensive position. So I'm extending my shoulders and hips without changing that area in my spine. So I'm showing you from a side view. From a front view, what you're going to notice is that my hips aren't going to bend in or slide to the side. So everything is tight and controlled. You see no rotation and no outward drag as I perform these. So a little tip, and it's going to help to strengthen the inner thighs. I want you to fixate on trying to create a little like screw in at an outward degree, very, very slight and controlled. That'll help with that cross. So as I do this, I'm focusing on rooting through my glute and kind of creating that stabilization through my leg and through my core as I do this. So if you're feeling really saucy with this, you can either place a book or a ball at the base of your spine and try to make it so it doesn't fall off. You should try to do this at a 2-rep thing, a 2-rep frequency, and you could do upwards to 10 to 15 reps, slow and controlled. That is the name of the game of that one. The next I'm going to do is upping the ante of that hip hinge. We're going to start at a kneeling position with this. We're going to have our arms in an overhead position, and I'm going to try to have you trot to hip hinge downwards without creating a change in that arch of your back right there. So once again, you can get a mirror or have someone watch you. What you want to avoid with this is that arching, as I'm doing right now. So that disengagement of the upper frame of the core, you want to hold that and lock that in and bring your butt down towards your heels as you perform this. Notice the entire time I'm doing this, my back stays in a relative stable position. 2 sets of 10, 2 sets of 15, slow and controlled. If you want to add a little spice to that one, you could have a band placed just at the base, at the top of your pelvis. So you're going to put this around the rig, and you're going to stand within the side of it. So you're just pretending that I'm in a rig situation. And as you bend down, it's going to make you challenge that stability more. And then you're going to press up with your hips to thrust back up into that upper position. If that's too shaky or difficult, lay off of it and just try with that normal upward above the head position. The last one I'm going to have you try to do is laying down. Well, I'll send you a separate video with that one because I can't seem to get my phone to cooperate right now.